day to this very important topic. My name is Jennie Noll, and I'm a professor at Penn State. I've spent my career as an NIH-funded scientist studying the problem of child maltreatment and solutions. I'm the director of the first ever NIH National Capstone Center for Child Maltreatment and Advocacy Studies and Research and Teaching. And that has been bestowed on Penn State. It's a very big honor, and one of the things that we're trying to do with that center is to be a resource to policymakers when it comes to culminating the research, synthesizing and distilling the research into messages that can resonate with legislators in terms of the traction they need to help with legislative action. So we are a resource in that way. So we want to be a resource today. So my job today is to do just that for you, to tell you about the scope and gravity of child maltreatment, but also how many dollars are spent on child maltreatment and how many dollars will be saved if we think about prevention in innovative and efficacious ways. So today we're going to start by an orientation about the scope of maltreatment. And then we're going to see examples of both primary and targeted prevention efforts in North Carolina and Colorado. Then we'll hear from a former CASER worker who's also a foster parent about how the Child Protective Service system presents significant challenges. And then finally we'll hear from a survivor who can help us understand the challenges of navigating that protective service system from the perspective of a consumer. Just so you can understand the sponsorship today, this is being sponsored in part by Partners for Our Children. It's a policy think tank in the School of Social Work at the University of Washington, Seattle, and also co-sponsored by the American Psychological Association, Division 37, that's Child and Family Policy section on child maltreatment. And it should be noted that these remarks do not necessarily reflect the views of the American Psychological Association. All right, in your packet, all right, there is a feedback form, a task evaluation form provided. Please fill that out. It would be very helpful for us moving forward and how we structure these kinds of talks and briefs in the future. So it's very important. Thank you for considering that. All right, to get us started then, we will have Alex Payne, who's the Education and Policy Advisor to the Office of Congressman Bobby Scott, who is the incoming Education and Workforce Committee Chair, which has jurisdiction over the reauthorization of CAPTA. So Alex is just going to give us some remarks from a legislative perspective, and just please note that these are not official comments and should be considered off the record. So Alex, why don't you come on? Thank you.
Hi, good afternoon. So Congressman Scott couldn't come and speak today, so on behalf of him, though not comments from him, I am here to just give a brief opening. I'd like to say he would like to extend his thanks to the panel and to the sponsors for putting on this event, especially seeing that it's geared towards more prevention-focused efforts and the success and research evidence base of those. He sees that as very timely because come January, when the new Congress convenes, it is one of his big priorities to have a push for a bipartisan CAPTA reauthorization that's comprehensive. And in doing so, a principle that's hopefully put forward is a focus on prevention efforts that we'll be hearing about today. So on those notes, if your boss for ledge staff who are in attendance have priorities around CAPTA, please feel free to send them towards us so that we can see them and try and incorporate them if possible. But that's really all that I have. Just quick, we can get to the experts, and thank you very much for coming and organizing this.
Thanks, Alex, so much, and for devoting your time and your energies to this. All right, so let's get started. Why don't we start with Dostoevsky? If we can. Okay, right. So Dostoevsky in Brothers Karamazov devotes hundreds of pages to gruesome accounts of child abuse. Hundreds and hundreds of pages. And he does this, of course, for the plot line, because we need to understand how the main character loses his faith and loses his faith in humanity. But he also does it to start a conversation within his community, within the culture of the time, that didn't talk about child abuse, that didn't talk about the heinous crimes perpetrated against children. And he started that conversation in 1880. And we're still having that conversation, meaning we haven't solved this problem. Even today, after all of the advances we've made in society, we still need to have the conversation. We still need to talk about it, and we still need to be heard about how child abuse, child physical abuse, child sexual abuse, child neglect are still a significant problem in our society. The tale that we're going to tell today is not a pretty one, but it's still that tale that needs to be told. It needs to be told so that families can be supported, so that children can be protected, so that we can come together as a community to solve this complex problem. So let's put this into context for you. Each year in the U.S., 7.4 million children are referred to the Child Protective Service system. And 3.2 million children endure an investigation. More children die each year from child abuse than die from all pediatric cancers combined. The U.S. is actually number 2 in the developing world, second only to Mexico, in terms of the number of child deaths due to child maltreatment. Each year, over 3% of children will be investigated or served by the protective service system. And it's important to note that these numbers haven't really changed much over the last several decades. In fact, in the last decade, we see a marked stagnation in terms of the rates of child abuse in this country. So what this says to me is that our prevention efforts are not really changing things and not really moving the dial when it comes to rates of child abuse. This is a call for innovation. Just to put child maltreatment in context of other childhood conditions, some really good work by a team that looked at data between 2004 and 2011 shows us that 12.5% of children in the U.S. will be a victim of child maltreatment by the time they turn 18. When put in context with other major childhood conditions, child maltreatment is number 2, right? This is a rate of occurrence that is not nearly as commensurate as the amount that we put toward prevention. And it doesn't stop when a child is referred to the protective service system. What we know is that once children are referred or investigated, 40% are re-referred and 20% are re-victimized within 5 years. So this tells us that this Child Protective Service system is a prime opportunity for prevention when we think about preventing child maltreatment. And the outcomes for victims are sometimes quite dire. What we know is that after a child has been maltreated, we have known for decades about the mental health sequelae, about the mental health problems that often follow from an instance of child maltreatment. And very recently, we've been learning much more about the behavioral health outcomes: substance abuse, alcohol dependence, school dropouts, rape, domestic violence. And maltreated females become teen mothers at 5 times the national average. We also are beginning to understand the real, tangible connection between maltreatment and physical health outcomes. Everything from preterm delivery to cardiovascular disease, cognitive deficits, and even premature death can be directly tied in a causal manner to child maltreatment in prospective and large epidemiological studies. And this happens regardless of substantiation status. So what this tells us is that children involved in the protective service system could be prime targets for prevention of all of these other very significant public health problems that we care so much about. So thinking about prevention from that angle is something we need to wrap our minds around as well. What are the costs then of not preventing child abuse? Really good work shows that the average lifetime cost per victim is about $200,000, and that $124 billion in costs for 1 year's worth of victims is the price tag on child maltreatment. That's about 1% of the GDP, and these are 2010 dollars. I really think this is a conservative estimate because these estimates do not take into account some of the other public health problems that I showed you in the previous slide. So how does prevention work, and how can we think about prevention for CAPTA to be maximally effective? We need to think about primary prevention, of course, stopping maltreatment before it happens. But we also need to talk about targeted prevention, right? Or stopping it from happening again, or preventing the poor outcomes of children who are survivors of abuse. So those at the highest risk. And we also know that prevention works best when there are coordinated efforts, when we have schools, parents, adults, government agencies, and providers working together. That's when prevention is the most effective. And we needed data-driven approaches. They're vitally important because what we know is that our current efforts have shown little to very modest impacts, and that they are minimal and variable depending on what type of abuse we're looking at. There's very little to point to where we can see universal prevention efforts for childhood sexual abuse, for example. And then there are significant challenges to coordination across agencies. So data-driven approaches where we can talk about the evidence base of prevention programs is very much needed. So the objectives today then are to get an example of a primary prevention program, Triple P in North Carolina, then talk about a targeted prevention program in Colorado, and then we'll have some tales from the front lines from a former caseworker and foster parent, and then words from a survivor.